another thing, people often, when they're already dealing with this, they have worked out a way that they feel this is going to work best for them. Some people may have you empty the stool into a long or a tall cup or something with a gradient so that you can measure how much is coming out, something reusable. This is just a paper cup we're using as a prop right now. Or they may have you use some form of basin, something like this or this. Or maybe some people on the go in a pinch might have you doing it into some sort of garbage bag. It's, you know, people have often figured out what works best for them. And then too, when it comes to cleaning it, sometimes it might just be some water. We're gonna pretend there's water in there that you would put into that open bag to clean it, swish around, and then empty back out, trying to loosen up any hard stool pieces that have gotten lodged in there. We're not actually massaging the ostomy ever. There is an ostomy here. I don't know if you can see that. That's sort of what that would look like in real life right here. There's an example right here next to it on this dummy. We're not massaging that. That's not what you're doing. But you're just oscillating and jostling the bag around a little bit to break up anything that, you know, might have gotten stuck so that it can wash away with the liquid. And some people may use water. Some people may have some sort of special cleaning solution. This is not that, but we're gonna pretend. And they are gonna have that ready. It's often blue. You put a couple drops in there, swish, swish, swish. Or they might have a deodorizing liquid or all kinds of things to help them through this process. Let's talk about some things though that a standard caregiver cannot do. So CNA and HCA, they can empty the bag. We can open that up, we can let the stool out, and we can let the air out. We can put a little liquid in there, clean it out, and seal it back up. But you know what you cannot do? You cannot remove the bag. So this is not something the caregiver would do. You would not remove this bag. Another thing that a caregiver is not supposed to do is anything with this wafer here, where this is actually stuck to the person's skin around their ostomy. That is something that a caregiver can also not do unless delegated. Delegated caregivers can perform those tasks. But just standard caregiving, you can empty the bag, just like you can empty your ostomy bag. You just can't remove the bag, reattach the bag, or do anything with the wafer underneath. All right, thank you.